Hello all, are you noticing trouble while holding things? The grip of your hand is becoming weak, things are getting awkwardly, you are dropping off from your hands. The smallest activity like opening and closing the door is getting difficult. Well, my dear friends, it might be sign and symptoms of tennis elbow. Well, hello all. This is Dr. Veena, and you're watching my YouTube channel, Dr. Veena, your homeopath. Well, today's topic is going to be about tennis elbow. Stay tuned with the whole video because I'll be explaining about what is tennis elbow. I'll be explaining about its homeopathic treatment, and finally, I will be giving tips if you have tennis elbow, what all to do. Let's start. Well, friends, tennis elbow is also called lateral epicondylitis. Well, what is lateral epicondyle? Well, there is an inflammation of outer part of the elbow. The bony growth is there, and that is the outer part of elbow. There we have inflammation, and it is called tennis elbow lateral epicondylitis. Now let us see who all are at risk and what are the causes of this tennis elbow. Well, as the name suggests, tennis elbow. Yes, those who play tennis frequently, they might have the higher risk of this condylitis. Well, it doesn't mean only tennis people have. It is not exclusive to that, but it means if there is more usage of the wrist, more usage of the arm, at elbow joint, there is more usage, those people are affected. So sports like squash, sports like where rackets are used like badminton, squash or javelin throw, discus throw, or cricket where bat and ball, the activity from the wrist as well as the elbow is more. These people are affected. Well, fine arts like fine activities like sewing or artists, they are also get affected. People who uses more tools and the activity is around centered around the wrist like plumbers, carpenters or gardeners, they are also affected. So more and wear and tear is there, more usage, repetitive motion, these are the causes of tennis elbow. Now let us see what are the symptoms of tennis elbow. There is, as I said, there is an inflammation around the lateral epicondyle. So whenever there is inflammation, there will be tenderness, there will be swelling, there will be pain, little redness will be there. But more than that, first sign and symptom will be the loss of the grip. Why? Because here the lateral epicondyle, the tendons and the muscles of the forearm are involved, wrist and forearm is involved. So definitely the weakness will be there in forearm, the wrist. So all the activities where we have to hold things, where we have to do like this, moving the elbow or wrist will be affected. So the first sign and symptom might be just holding a cup of mug is difficult, or using door knobs opening and closing is difficult, or when you are in bike and you have to accelerate your bike, again that is becoming difficult, or just while handshaking the grip is weak, you can have this basic signs and symptoms. Or ladies who want to make chapatis, that movement is also becoming difficult, things are getting awkwardly, they fall off from the hand, the grip is becoming weak, they might be the first sign and symptoms of tennis elbow. And after that there will be lateral, here in the lateral epicondyle there will be pain will be there will be little swelling or inflammation. Because of inflammation, swelling will be there, tenderness will be there. So these are the signs and symptoms of tennis elbow. Now let us see what about homeopathic treatment. My dear friends, there are many medicines in homeopathy. According to the sign and symptom of the patient, the medicine will vary. I'll be explaining few important first top notch medicines of homeopathy. The first medicine I'm going to discuss is about Rhus Tox. Well, Rhus Tox is a very wonderful medicine in homeopathy whenever there is muscles or tendons are involved. So here the muscles are, forearm, the forearm muscle, forearm tendons, and wrist is involved. So Rhus Tox really affects beautifully well in these cases. The characteristic pain of Rhus Tox is, the pain will be like sprained, something, the muscle or tendon is sprained, or it has been torn off, or it is being scrapped from the bone, is being scrapped from the knife. So these kind of pains, this is the characteristic symptom of Rhus Tox. Well, one more, its modality, that in Rhus Tox there will be, aggravation of the pain whenever, affected joint is at rest. But whenever, the movement is there, whenever the person is working and anything, the pain is gone. It is emulation, the pain is, better. But once, resting at the time of, sleeping time, or there is no movement, resting time, pain will be more. So in these cases, Rhus Tox really affects well. Second medicine is Ruta. In Ruta also, whenever the wrist is involved, whenever the tendons are involved, Ruta really affects well. Characteristic symptom of Ruta is bruised feeling, as if the joints or the muscle affected is bruised, and it is as if it is being, beaten. So that kind of sensation, that kind of pain characteristic, Ruta is the medicine. Well, third medicine is Belis Per. In Belis Per also, I usually give in tincture or low potency forms. In Belis Per also, wherever muscle tendons or injury to these are there, injury to the muscles, Belis Per is works very well. Next medicine is Bryonia alba. Bryonia alba also affects whenever there is pain, wherever there is muscles or tendons are involved. Its aggravation and amelioration is just opposite to Rhus Tox, where the pain aggravates while using the joint, but amelioration better when the pain alleviates, that is when it is at resting time. So there, if these are the modalities, then Bryonia alba. Next medicine is Rhododendron. Rhododendron is also very effective in condition wherever the wrist, tendons, muscles are involved. In Rhododendron, very important thing is whenever the pain is aggravated during a climatic condition, that is before storm or thunderstorm, in these rainy season where thunderstorm is there, these condition, this tennis elbow again lapse. So in that cases, Rhododendron affects really well. Well, friends, there are many other medicine. Let me just tell, Apis mellifica as well as Bovista really good in conditions wherever the person says things just falls awkwardly from my hands. The grip of the palms are not good. They are becoming weakened and weakened day by day, and the person is saying not able to even hold a mug of cup. So in these cases, Epis can be given, and the burning pain, burning sensations are there, burning pains at night. There is complete burning pain in the forearms. Medicine can be given as Epis. In Bovista also, awkwardness is also there, things getting dropped from hand. Bovista can also be given. So these are the basic medicine. Now let us move on to our third section, that is what to do if you have tennis elbow. Well, friends, if you have tennis elbow, with the homeopathic medicine, we need to stretch these muscles. These muscles has to be stretched. First of all, let the acute condition, acute pain, just subside. Then it is recommended for basic stretching exercises. Well, for acute condition, the pain, if you have pain, you can put ice cold packs. It really helps to bring down the pain. Similarly, you can massage this part with oil and just repetitive movement over here. It really helps to alleviate the pain and inflammation. Now after the pain, the acuteness of the pain goes away, you need to strengthen your forearm muscles. For that, you need to stretch it. For that, just dorsiflex your palm for 10 seconds or 20 seconds and keep it like in this position for some time. Similarly, palmar flex also like this. You can go for acceleration kind of movement where there is wrist and forearm is involved. Just see, forearm is involved. Similarly, you can just supine and pronate. Supine and pronate. So these are the basic exercises for tennis elbow. So along with homeopathic medicine, if you do these exercises, you can strengthen your forearm muscle. You can help. It will really help. The pain around the your lateral epicondyle. Well, saying this, let me conclude. If you really like my video, you think it is informative enough, please like, please subscribe, and yes, hit the bell icon. Till then, thank you and goodbye from me.